Hi, I'm from Bangalore. I discovered this problem at home late at night when I had gone to brush my teeth. I had lifted my tongue and I saw this huge lump. I got worried because it's not a very usual place to have a lump. It was quite big. So I told my husband the next morning, I said, whatever happens, we are going to our family physician, Dr. Thakapa. We have to go. So he says, no, we'll go. So when he examined me, when our family physician examined me, he didn't want to take any chances. So he fixed up an appointment with Dr. Pallika, and we came here. He examined it. He took an X-ray, and then he said it's quite big. We have to do surgery. Surgery means how long, what are the complications, because I'm diabetic, I'm hypertensive. I said, no, this is really torturous. We said, okay, anyway, we'll come and see you next week. Then we came back the following week, and he said, no, we can do it under local anesthesia, which relieved all of us. And I'll tell you one thing, the treatment I got was excellent. Dr. Pallika and Dr. Sam, I have no words for them. They're both very confident doctors. Dr. Pallika was very confident. He wasn't worried about the diabetes, he wasn't worried about the BP. He says, nothing, you're not going to get affected at all. And there was no bleeding to speak of, so that also was a big relief. So once I finished with the procedure, something struck me. I was sitting down there waiting for my husband, and I was doped out, sleepy with the painkiller and the sedative. And they had come back from their lunch. I was really touched. I had come back from their lunch, and Dr. Sam saw me. He says, what are you doing here? And Dr. Pallika asked me, why are you here still? I said, waiting for my husband. He asked me, have you taken a painkiller? I said, no. He sent the nurse with a glass of water and gave, and I swallowed my medicine. Then they saw I was going off to sleep. They said, would you like to sleep inside? I didn't want to, but nevertheless, I found one thing. Dental department, excellent. Caring, good treatment, and reassuring. See, I mean, nowadays you need someone who can really put a patient's fears at rest. And I'm terrified of anything dentistry. All of us are, in fact. But this treatment, this medical procedure that they did was really fast and painless. That's what I don't, that's what really still can't get over. And it was a big stone. So I'm really happy that I came here for this dental treatment. I would sincerely recommend it. Dr. Pallika was really excellent. Dr. Sam also was very reassuring. I mean, they have time to talk to you. Because I chewed up their brains about, I'm a diabetic, I'm a hypertensive, what will happen? They said, no, don't worry, nothing will happen. And truly, nothing. Even now, it's now 1 week. So, I'm fine. Thanks to them.
This 65-year-old lady was referred to me by a general practitioner because she had a painful swelling in the floor of the mouth for about 3 weeks duration. So I had a look and I was surprised by the size of the swelling. And the tongue was raised and she had difficulty in swallowing. We took a couple of x-rays, and by mere touch I could find, to my big surprise, something very hard under the tongue. Usually the first thing which came into my mind was a stone. Stones are very common in the body. When somebody talks about a stone, we think about a kidney stone, then stone in the gallbladder. These are all most common. But a stone in the salivary gland or one of the duct is not that common compared to the other stones in the body. Right. This required a surgery, and I explained to her, and it is a straightforward surgery. We could do it under local anesthetic, except that we had to be careful that we don't damage any of the nerve which goes to the tongue or to the muscles around the tongue, or damage the duct itself, or damage blood vessels, which are very common there, which can give rise to bleeding. So we gave local anesthetic and gently removed the stone. You'll be quite surprised. This is the stone I removed. I have never ever seen in my life a stone of this size under somebody's tongue. Well, she asked me one question, why this came into my mouth at all? How did it come? She's a diabetic, and people who are diabetic, and this was a rainy season, they don't drink enough water and they get dehydrated. Mouth quite dry, and if there is a trivial infection in the duct, immediately you get stone formation. Just like tartar, a stone forms and the stone keeps enlarging in size and assume this size. This is one of the peculiar surgery we have done recently.